Dr. Nathan Bacheta, WHO representative in the Gambia, is still with us. It's coffee time with Peter Gomez on Monday, the 27th of October 2025. And we move from mental health to measles and rubella, now on to World Polio Day celebrations. What does World Polio Day mean in a country like the Gambia, given its polio-free status? We're told that we are polio-free.
Well, thank you very much. First of all, I need to congratulate the Gambia for being polio-free since 2004. That is World Polio transmission, World Polio virus transmission since 2004. However, as long as polio is still in our neighborhood, okay, we still are at risk and have to continue vaccinating. Now, what happens is that we're World Polio virus free. However, when we give the polio vaccine, all right, some of it is excreted by the child, and then it can infect other people, and it keeps multiplying. And in the process of multiplying, some of it may revert to one that can cause disease, what we call circulating vaccine-derived poliovirus. In fact, we had an outbreak of that a few years ago, and we had to have a mass campaign in this country. How did we detect it? We detected it from our environmental samples. So Gambia is one of those countries that has environmental surveillance sites where we collect stool. Can you imagine? We collect stool from some of the sewage places, and we test it, and if we find a vaccine-derived poliovirus, then we do what? We vaccinate them. So we still have that happening across the continent. And in fact, some countries right now are managing those outbreaks that have come out of vaccine-derived poliovirus. But coming back to the day, 24th October was selected as a special day for remembering this. Because when you look at what polio used to do, the number of outbreaks would do, and the devastating impact of polio, to see that we have reduced the cases by 99%, we feel that we still need to come and commemorate that day, our achievements, but also to remind ourselves that we still have some work to do. That's why the theme this year is End Polio, Every Child, Every Vaccine, Everywhere. And in the Gambia, again, we need to pat ourselves on the back. In 2024, we achieved a 98% vaccine coverage when we did a nationwide vaccination campaign, but we still give the polio vaccine in the routine system when mothers bring their children, when children are born, in order for us to make sure that we keep the immunity up, so that in case any of those vaccine-derived polio viruses come up, our children are protected from that. And again, here I want to mention the work we do with Rotary International. They are doing it. They have been with us from the time the Global Polio Eradication Initiative was started in 1988 up to now. And then UNICEF, of course. Then Gavi, the Ministry of Health, leads us in that. So we think that if we are able to protect our children from polio, then we can make a difference. I remember I was in Zambia. So when you hear me say Zambia, Gambia, you now know where it's coming.
At some point, you were trying to reference the Gambia, and I could hear the Z coming through.
Yeah, I had traveled out of the capital where I was the WHO rep, and on the way back I was told, we have a polio case, a vaccine-derived poliovirus case that had caused a case. So it meant we had to do a polio campaign across the entire country, because once it's there, then you do a risk assessment and do that. So we flew by helicopter. That's one of the few times I flew by helicopter, and it's frightening, I tell you.
You won't fly one in this country, I can assure you.
It is a frightening thing. So we flew by helicopter to the place where we were supposed to launch the campaign, with the Minister of Health, the PS, and the Director of Health Services. So we get there, we launch the campaign, and then we had an opportunity to visit the home of the child who had developed polio. The child was 2 years, 8 months, I remember, a girl. So when we arrived at the home, they were seated, everybody was seated, and they told us this is a girl. Very healthy, well-nourished child. I still remember that girl. And then they told us the girl. I said, okay. It's when they tried to make her stand up that we realized that her legs were gone. She couldn't use any of her legs. And then I said, wow, this child's future has been dramatically altered because one of us missed getting her the vaccine she needed to do. A girl who used to go out to play with the colleagues, who would go to do all sorts of things, now has to be helped for the rest of their life. We hope and pray that rehabilitation services will eventually make that person independent. But those are that picture will never, ever leave my mind, Peter. I'll always live with that. And whenever these polio campaigns come, that picture drives me to do whatever I can to do our best.
And I suppose that's why you are firmly behind ongoing surveillance and prevention efforts in the Gambia, just to maintain our polio-free status.
Exactly.
Okay. How does the Gambia's experience compare with other countries still battling polio?
It must be said that for many years, Gambia had one of the best primary health care systems, and your immunization coverage was good. But it was affected by COVID-19, just like everybody else was. So what we are doing is we are rebuilding back to where we were before. I must say, we're not, when you compare with other countries, we are not definitely at the bottom of the pile, one of the good ones, but we need to do more to make sure that we improve the services that are provided so that people can get them every time they need them. But our coverage figures are reasonably good.
And what role does community engagement play in keeping not only polio, but other diseases like measles, rubella at bay?
I think in my experience as a public health worker, I've learned one thing. Anything you try to do on health without involving the community, you will suffer. Because with the advent of a lot of sources of information, the communities have their own sources of information and the people they trust. So you must approach the community with respect, listen carefully to what they say, and explain things in the language they understand. So for me as a WHO rep, I insist to my staff, whenever we go out, I say, make sure whatever you say is in a language the community understands. Simplify things as much as possible, because they are our greatest allies. Some of the influential community people can just say, in this compound or in this area, we will not get vaccination, and that will be the end of it. So they are very important. So what we do is to make sure we provide them information, but in a form that they can understand. Of course, there are these public awareness campaigns, but where you have difficulties with people aligning with what you want, then we encourage interpersonal communication. What are your real issues? And we find that when we engage with that, of course it takes a lot of resources, both human and time, but when you do that, you find that many people are willing to listen as long as you approach them with respect and also in a language they start. So community is extremely important. If you doubt, one of the reasons why the Ebola outbreak in our neighboring, it was Guinea, isn't it? It was Sierra Leone and Liberia. One of the reasons why it rode on for long is that people did not understand how to engage the community. And until they had fixed that, we were not going to make any headway in covering that outbreak. Look at COVID-19. If the community had not cooperated in coming forward for vaccination, we would still be grappling with COVID. So it's important.
Absolutely. Still with us on Coffee Time with Peter Gomez this Monday, the 27th of October 2025, is Dr. Nathan Bacheta, WHO representative in the Gambia. Before we began the conversation, and I mentioned the fact that World Polio Day commemorations or celebrations had passed off quietly. I mean, not as public as, let's say, Pink October, which we used to raise awareness about breast cancer. You gave a very interesting explanation. Let's now get into Pink October. But before the question on Pink October, so why did World Polio Day pass off almost unnoticed? Whereas, every day you hear about, breast cancer, Pink October.
I must say that at the moment, every commemoration you hold costs money. It costs organization. So in the current funding environment, all right, you find that different funders have cut funding and so on and so forth. So there are a lot of people who, so when you have to choose which days you have to do, you are doing that versus the pocket that you have at the moment. But also when something comes under control, sometimes even when you hold a commemoration, people don't take it because it has become controlled. They're no longer awed and frightened by something.
It's not urgent, in other words.
No, it is urgent, but people are no longer frightened because they hardly ever see that. So that is likely to happen. But also the funding situation now means that we may not be able to hold the commemoration, not only of polio, but of many other things like we used to before, because you have to make a decision on whether you put money in treatment or prevention or awareness and all these other things. So that also influences what we can commemorate.
So how is WHO involved in breast cancer awareness campaigns during Pink October?
We are very, very involved in that, and we love to participate in that because we know that cancer of the breast is one of the leading causes of cancer among women. But also, the reason why this is very important to us is that cancer of the breast can be, if detected early, you increase the chances of cure. So we join in and tell people that, look, raise awareness that it is amongst us, but also talk about what can be done. For example, we encourage women to do breast self-examination. You find that many of the cancer of the breast that have been detected, women first felt a lump or just said, I feel there is a swelling in my breast, or there is a liquid coming out of my breast that is not normal color, or the way the skin of my breast looks is different, or one nipple is not at the same level as there. So by through self-examination. So we encourage women to do that. And the frequency is maybe you do it once a month, and if you are a woman in the reproductive age, so when so the time you have your menses, all right, use that time also to check your breast. Now, some cheeky people say your significant other can also help you to examine your breast.
Can they?
Well, it depends upon couples, okay? Because the techniques are there, but if your significant other can also say, but your breast, there is something wrong with this breast. But this is a conservative society. Yeah. I'll leave it there. Yeah. But in other societies, people think about that. But generally, men can also get cancer of the breast. It's mostly in women, but also men can get it. So examination of the breasts by self-examination. And then take advantage of the time of the outbreak. I mean, not outbreak, at the time of this Pink October, where screening services have been set up at Edward Francis Small Teaching Hospital, but also other health facilities and other community centers. They have been advertised by the ministry. Take advantage and get that examination done and so on. Yeah.
What are the current statistics or trends around breast cancer in the Gambia?
I think the last time I interacted with the people, he said that I think in a certain period of time, I think it was about a year or two, they got over 2,000 cases of breast cancer. I think, coming through the hospitals here. I have to look up the exact figures. So the point is, it is here with us, okay? And we have certain rates that show that we have it with us, and so people should be on the lookout. But if you are not looking out for it, maybe you may not see it. But if you feel those symptoms that I've talked about, go and have somebody look at it, and then they tell you whether you have it or not.
And all these screening programs you just referenced, offered by the Edward Francis Moore Teaching Hospital and other health outlets, how are they supported? And especially by the WHO?
WHO this time, we did not put in any money in those screening services, but we know that many other partners have put in, and some NGOs and CSOs which are supporting that are putting in that, but we helped with the technical work and also the awareness, spreading the awareness. And
just finally, what message might you have for those women who may be hesitant to seek help or, go for screening?
What I would say is health is your wealth. So it doesn't matter how rich you are. If you are not healthy, you'll never be able to enjoy those riches. So I encourage women to find time and go and have that screening done, because if it is picked up early, then some remedial measures may be taken place. They can put up a plan, which it could be surgery, or it could be radiotherapy or chemotherapy. A plan can be developed early. The other thing I would say is that if we take our health seriously, then we should, beyond just the breast cancer screening, we should also look at cervical cancer screening. That is another common cancer here. Women should go and make sure that periodically, especially when you're a certain age group, you get screened also for cancer.
I know they do the screening for the two together, but because the emphasis is on breast cancer during October. Do you think cervical cancer or cervical cancer should also have its own time when the emphasis would be on it?
So far, we've not had. I think what is happening in the countries that I know, and certainly coming up here too, is that it has been in countries especially which have high HIV prevalence. One of the things they discovered that the people with HIV tended to have a higher propensity to get cancer of the cervix. So that screening has been expanded, building on the availability of HIV clinics. Here, I'm yet to study that. But what I would just say is that having a separate day for everything will make that so much. What we need to do as the health sector is to say, we have this day, but what else can we integrate? For example, we had talked about it was supposed to be a measles rubella campaign. However, we said, since it's the same children, the same target, also deworm those children, give them vitamin A, and also weigh the children. So a child gets...
So you're doing 5 things at once when you were meant to do just 2.
Exactly. So we look as much as possible at integration, because these days we are talking about people-centered services. You look at the human being as a whole, because the human being doesn't present with just a breast or whatever, they breast with everything. So where can we make sure that when somebody comes, people-centered, everything that needs to be looked at in that period of time is looked at?
Dr. Bacheta, thank you very much for your time this morning.
Thank you too.
Dr. Nathan Bacheta, WHO representative in the Gambia.
Jar Oil. The company have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
Excellent jam, Suway.
Yo, apply. Yo, luta to dede. Luta mo nulo jel mo to nga andil mahalis. Hello?
Gusto mo fine.
What?
Eh, fine. Wave acts in Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. Ak Wave, bustle mu fine. Wave, your money is yours.